Dr. Rhoda Ojwang. I am the founder and president of Healthcare Access International Group, also known as HAIG. HAIG is not even a year old. It was started back in June of 2018. And the purpose, the mission of this organization is to make healthcare accessible among the underserved. After starting the organization, the registration process took a few months, and we are currently registered as a nonprofit 501c3 in the state of California. Like I said, the purpose of this organization is to make healthcare accessible among the underserved. So once the registration process and all that was done, I put together a group of leadership team for this organization. And currently we have 3 board members. Like I said, I am the founder and president of this organization. I have Ms. Caroline Obera, who is the vice president, and I also have Dr. Daphne Kanyaru, who is the treasurer and a board member too.
So I'm here in Kitale with a group called HAIG, Healthcare Access International Group, and we are a group that's a non-profit organization that plans to do missions in Kenya and Africa and globally. So this is actually our first mission. We came to Kitale and been seeing people of Kitale for 5 days now. So as a family physician, I deal with people from all the ages. I deal with kids, I deal with pregnant women, adolescents, adults, and also geriatrics, which are the elderly. So these are the kind of patients that I see on a daily basis.
I am a member of Healthcare Access International Group, a group that was founded by Dr. Rhoda Ojwang. I live in Boston, Massachusetts. I'm a registered nurse by profession, and I was intrigued when Dr. Rhoda came up with this idea to form this group so that we can give back to the community. So I'm privileged to be with this organization in the capacity of a vice president. There are so many healthcare needs that we did identify, and we are looking into partnership with other organizations in the healthcare field so that we can give back to the community.
We decided to bring the services to Kitale because I was raised in Kitale, and there's a lot of underserved areas in Kitale. So that's why we are here today. Our camp started March the 24th through the 28th. That's Sunday, Monday, Tuesday. Today is Wednesday, and tomorrow is our last day. We've been working from 8 to 4 all these days, and tomorrow is going to be 8 to 12.
This has been really a humbling experience, being able to see our local people. We are from Kenya, I am from Kenya, and Dr. Rhoda, who is the president and founder of the organization, comes from this area, so it was a good place to start. And we have been able to see a lot of patients and been able to take care of them. A lot of the diseases are the diseases that affect people locally that a lot of times I don't deal with, in the US, but has been a good learning experience working with the clinical officers, but also, stuff that I deal with every day, like blood pressures, hypertension, colds, allergies, and stuff like that. So that has been a good experience for me. And also, being able to take care of these patients has been a really good experience, being able to offer my services to them and be able to give back to my own people.
Asante kwa wale ambao wamewatuma na wale ambao wameshughulika kwa ajili ya hii shughuli, tumesema asante. Tuko wengi, tuko na kina mama, tuko na wazee ambao wamejitokeza kuja hapa. Asante, maana Mungu ni mwema na ametujali na amesikia maombi, maanake hatulipi pesa.
Hata tungeomba waendelee kama ingewezekana, lakini kwa sababu wanatoka mbali basi, lakini tumeshukuru Mungu kwa vile wametupa huduma hii.
My name is Rebecca Karimisoi from the county pharmacy. I'm a pharmaceutical technologist. We are here in a medical camp, Healthcare International. We are one of the people who are doing comprehensive care in the pharmacy department. We have been here since Sunday, and we have been seeing our people. They have come in large numbers, and especially we have got almost all the drugs that are required by them. We have been providing for them the services, and we thank God and we thank the sponsors of this medical camp because they have given us the best, and we appreciate even the county government for giving us a chance, and they were here and they gave us a go ahead, so we are happy, and we thank God for this opportunity to serve our people in Trans Nzoia.
Initially, when we first came, we had about 5 services that we were going to be providing. We added a couple more services to our list. Number one service that we are providing for our community here in Kitale is cervical cancer screening and breast cancer screening. This service, as we speak, is still being conducted, is in process at the Kitale District Hospital, and we are in partnership with AMPAD. So all the positive findings from this via VILI screenings and breast exams are being followed up with AMPAD. AMPAD, yes.
I am an obstetrician gynecologist. I'm coming from Kenyatta National Hospital. That's where I practice. I am here to conduct the cervical screening for cancer of the cervix, and also breast exam, to basically teach the women on how to do self-breast examination, and also to rule out any possibilities of them having any cancer of the breast. The turnout has been good so far, and we really appreciate the women who have taken their time to come. From the talks we've had with the women, many of them were afraid of having this examination done because most of them thought it was a painful procedure, but from interacting with them and from us examining them, they've come to realize it's a very simple thing which they need not be afraid of, and we got to really educate them and encourage them to be coming for the exams, and to even encourage their friends to come and have the tests done.
From 21 years to 49, those who are in the reproductive age, so we got out, but the others, but mostly from 21 to 49, the reproductive age. And not all, only those ones, but above 50 and above also, who have come. We cannot lay them out. We have to attend to them. And in case of any positives, usually cancel them. After cancelling, some we can take a biopsy for histology. When the results come, we usually tell them, we inform them. If it has gone far, we refer them to Chandaria Cancer Center in Eldoret. But those ones with stage 1, with CIN1, we can do either lip or cryotherapy, which we have inside here.
But from the outcome, because of this also mass screening that we are undertaking right now, the outcome has been good. We have also done several outreaches, of which the outcome demands for more time. A day isn't enough for all women to be screened in their villages. So we tend to work more on how we should cap those gaps, that how we could attend them much more. Unlike initially we used to do one day, but now we are finding more need of doing even hardly a week on outreaches, unlike what we've been doing all along, because we've seen the demand and the match they ought to have.
Cancer of the cervix is the greatest killer. It's the greatest. It has the greatest mortality when it comes to the cancers that we have in Kenya at the moment. So many women are not aware. By the time they come to us, majority of them have advanced cancer of the cervix. The problem with cancer of the cervix is that when it's in the first stages, there's no obvious symptom that it presents with. So many of the women who don't come for the screening usually miss out on the chance of us getting to catch the cancer at an early stage. catching the cancer at an early stage is a very good thing because there are very many modes of treatment which can be done to help save the life of the woman. But when you come to us and the cancer is advanced, then it involves a lot in terms of medication, financial implication, and even death. So yes, it's a very important thing that the women get to know about the status of their cervix because it will go a long way in improving the quality of their health.
Being a mother and having teenagers, it's very important for the girls to be educated on some of the symptoms of cervical cancer, and also all women that it's important every year for them to go to the health department to get pap smear. Prevention of cervical cancer is very important because it's, when caught on time, it's something that can be prevented and stopped. But mainly because of the way our bodies are made, it's invasive. Not really invasive, that it's private. A lot of people are scared of going to see an OBGYN, an obstetrician, and a gynecologist. So we want to encourage people to forget that phobia and that stigma, and to feel that they need to go see a gynecologist to prevent cervical cancer, because that is something that can be prevented, and there shouldn't be any worries in getting the care. Because once it advances to stage 4, then it's impossible to treat it, because now it's death is imminent, unfortunately.
Wallahi vile nimefanywa checking ina furaha kubwa zaidi. Daktari jinsi wanavyonicheck wakapata sina ubaya wote. Hapa matitini nikakakuliwa mzuri kabisa, sina ubaya. Wallahi wamama wenzangu nawaambia hamna hapa uoga. Kwa maana hawa ni wamama wenzetu, wasikue na uoga hata kidogo. Waache na wasema karibuni.
Sikuwa nahisi kama niko nayo, lakini ni vile hii janga la kansa limetapakaa, so tukaona ni afadhali kuchekiwa mapema. Nitaenda kuwaambia pia nao waje wakaguliwe, kwa sababu wakisikia ni screening wanaweza kuwa na uoga fulani. Nikiingia hapa nilikuwa na uoga, lakini venye nimekutana na dada zangu nimeona tu ni jambo la kawaida.
I came to this free medical camp which was organized by the doctors from UK, from United States of America. They have done a good work. I'm one of those people who are benefited. I've been screened, the breast cancer and the cervical whatever. And screening was a good one. It is not painful, it is normal. I am urging all the ladies who have not been screened to take their good time and be screened.
Yes, this thing is being done in partnership with AMPATH. AMPATH is an organization based in Eldoret which has its branches in other parts of the country, including Kitale. And one thing that they need to know is that even when we are gone, the AMPATH organization will be here, and the other team who work with the AMPATH to continue who deal with the screening will still be here, and they do it for free of charge. So they shouldn't shy away even after we are gone, because the services will still be on for free.
Another service that we are also providing to our women is genitourinary syndrome of menopause. A lot of people are not very familiar with that term. It was previously known as atrophic vaginitis, and let me just break that down. Some will call it menopause. You know, as women get older, their bodies' hormone levels decline, and they start to have issues with hot flashes, vaginal itching, and painful sex, those type of issues. So we are seeing those type of patients, and we have treated a lot of them.
The symptoms, the earliest we can see most clients come maybe above the 50s, those ones who have ended in the menopause stage. They will come with the bleeding. Me, I had finished my menstrual cycle, but sister, I'm noticing now the bleeding. If they are still in that stage of sexual activity, she will always say, I feel pain when I'm with my husband, when we are in that. I have backache, low abdominal pains. Those are the most, at least the earliest symptoms. But the late symptoms, she will come when she's anemic, because of the bleeding. And when I try to examine her, there's no way out. She has already gone to maybe stage 3A or B. So we have to take a biopsy, send to Eldoret, Nairobi, and they bring back, the results will come.
All the other services are being provided here at the Kitale Showground. We kind of had a change of venue close to the last minute. So the services that are being provided here at the Kitale Showground, we do have wound care. We haven't really seen a lot of cases of wound care. It's just been minor wounds, burns. We haven't really seen like stageable deep pressure ulcer type of wounds. Another service that we're also providing CPR and first aid training, and this service is a one-day service, and as we speak today, the class is ongoing. We have our CPR / first aid instructor, Miss Caroline Achieng Obera, who is certified as a trainer by the American Red Cross. So she has a group of 15 individuals in that room that she is teaching CPR and first aid, and these individuals will receive certificates of completion for that course today. So we did a needs assessment as we were talking about the services that we wanted to provide to Kitale, and we saw that this would be a service that would definitely benefit the community, because there's a lot of accidents happening, there's a lot of family accidents that can happen, and we want our family members to be able to understand first aid. What can they do before these patients can get to higher levels of care?
Right now, CPR and first aid, huduma ya kwanza, and we've had a very successful class today. They're asking for more. There's a need for CPR and first aid, and we are glad that we've initiated that process, and we want to see that department grow. We want to see them hold public events, and we just want to enlighten our people. Yeah,
the lessons were amazing. We learned so many things on how to save lives. It was interesting. Actually, it was the best class. It was my first and the very best class I've ever had on first aid. We learned a lot, and we are planning to make it. We are planning to put it in practice, not just take the knowledge and sit back with it, because there's so many people are supposed to reach to. So we'll do something about it.
I'm glad that at least there's that willingness to help. They want to help, but they don't know what to do. So just the heart that somebody is willing to stop and help is commendable. But the process of stopping and being a spectator or waiting for a vehicle to transport, with the knowledge of first aid and CPR, we can save a life, we can prolong a life, and we can make it easy for this person by the time they get to the hospital, that they can be catered for at a higher level. At least they have a basic knowledge of what happened. So it's just time factor, because in any emergency, time is of essence. So if they can know what to do at the scene to stabilize the patient, we give this patient time, or the victim time, or a chance to survive. So that's what I want to know. I want to see them do.
I have a heart to reach out to those in need, and this was an open through for me to get to more people in need of help. Plus I want to do a medical course. We want to pursue a medical course as we proceed with our studies. So this is a go through. This is a start of the learning. We are going to learn more as we go on.
Observation is that there is need for education. There's need for sensitization, and there's need for more town hall, social halls, public events for CPR and first aid for the layman person. I would like to see that done more. I've been challenged by these kids that I'm training today. They're in their teenagers, most of them, and they don't want to stop here. They're already forming a club. So we're going to talk about that, and they want support, and we'll see how we can work together also with the county government so that this goes forward. Our hope is that when we leave, they don't forget. We want continuity.
Yeah, I found out that it's easier to save life than I thought before. I used to watch in movies how they do it CPR, and I thought it was so hard, but I came to find out yesterday that it's actually the easiest thing to save a life. Yeah, it's just about being committed and that hard work, and that heart of not giving up, because someone can easily give up. It's not that easy, but if you are into doing it, you won't fail. So it's not that hard. They come out after the first thing is that, yeah, I can save a life right now.
Another service that we are providing today is vision screening and eyeglass care and treatment. We do have a couple of doctors here. We have 2 ophthalmologists that are screening and these patients, and for the ones that need surgery are being referred to Kitale District Hospital and other higher levels of care. And we also have free eye reading glasses that we are providing to these patients who need them, but the screening comes first. And we also have eye drops for patients that have glaucoma, cataracts, but like I said, the screening comes first, and then the doctors decide who needs treatment or who needs to be referred out. All this is free, and the eyeglasses are also free.
Nimekuja hapa kwa sababu ya macho. Nilimalizwa nguvu na pressure. Pande ya macho ndio ninajaribu nione kama naweza pata miwani. Yote ninaona moshi tu. Zaidi hii ya kushoto.
And for the blood sugar, for the diabetes, some of the symptoms that the people came with were, having issues with their eyes, which is one of the secondary diagnoses of diabetes. It affects the eyes. So we talked to them, and we're seeing that we've made a change, because with the medication compliance, we really stressed on compliance, because a lot of people don't realize that this is a lifestyle change. Once they're on medication, unless the doctor takes them off the medication, it's a lifestyle, and they have to continue taking the medication. So we let them know that where they are health-wise, ways that they can change to reduce the high numbers, which was an indication of having that diagnosis. Like for blood pressure, we had the parameters that we were going with, and they'll continue going to the local department.
Hii kipawa ya leo ni ya kipekee katika maisha yetu. Kama tungekuwa tunapata kama hii siku nyingine, watu wengi wangefaidika na wangesaidika. So tunashukuru Dona sana. Waendelee kusaidia watu wengine ili hali ya maisha, afya katika jamii yetu iwe afadhali.
The next service that we're also providing is diabetes and high blood pressure screening. Prevention is better than cure. An ounce of prevention is worth a pound of cure. So we are screening these patients, all our patients that come in, for diabetes and high blood pressure. And for the patients who have high readings, we do have, like I said in the beginning, AMPATH, which is our partner. We are in partnership with AMPATH for this camp in Kitale. Patients that need to be followed up, not being just left to go out and go back home. AMPATH is following up with those patients for further care.
We noticed that there are a lot of people who have undetected high blood pressure, which is hypertension, and also high blood sugar, which is an indication of diabetes. And we did a lot of health promotion and prevention education with diet, exercise, lifestyle changes, and also we have medical doctors here on ground, including pharmacists that we came with that offered medication with the continuation of care with the health department. So that was one of the things that we noticed. People did not know that they have high blood pressure, which is a silent killer. And most of them were asymptomatic, meaning they did not have symptoms.
I mean, we've seen a good number of patients that didn't know they had blood pressure issues, didn't know they had, diabetes, and so that has been a good chance for us to be able to educate them and be able to direct them to the right places so they can receive the care that they need.
Today is day 4 of our camp. Sunday was day 1, we saw about 120 patients. Monday was day 2, we saw about 150. Tuesday was day 3, we saw 200, and today is day 4, and I know that number is probably going to go up. And I feel like we have and are meeting our goal that we came out here for. Our goal was to reach as many people as we can. Like I say, this is a free service. Everything is free. The screening is free. The medication is free. We have eye drops, it's free. We have eye wear that's free for all these patients. So we had announced this camp on Facebook. We did posters, we did banners, we actually also went to the radio station, to the local radio stations, and announced our services. So I feel like this has been a good turnout. Many thanks to all the volunteers that have come out to help us get this done and make this a success.
So we've been talking to the patients and the community about health promotion and disease prevention, and mainly just to sustain having a healthy lifestyle and to manage chronic diseases. I'm excited because the locals have come in great numbers, almost in the 1,000, and we've made a difference. They're very appreciative of our coming here, and we're excited and we look forward to coming back again.
Kitale is home for me. I grew up in Kitale, and some of us were privileged to, get good schooling, good medical care, and you're still exposed to people who don't have. So having gone to school, finished my schooling, graduated, I sat down and thought of what can I do to help my people. So my target was the underserved, and when I say underserved, I mean the people that cannot help themselves. There are people who can't even afford 3 meals or even a meal. There are people who can't afford health care. They get sick, they prefer to treat themselves because they can't afford the consultation fee. So that's the population that I was trying to target. So that was my drive to open this organization.
We are looking into partnership with other organizations in the healthcare field so that we can give back to the community. So the main reason why we are here today is just to make healthcare accessible to the underserved and also give back to a community that we were born and raised in.
And truly I can tell you that I really enjoy doing this. Every day I see my patients, I feel fulfilled, and being able to come back home, I've always wanted to come back and give back to my people in Kenya. So that also has been a really good experience to be able to see that come into fulfillment.
Kenya is the first, or Kitale is the first mission trip that HAIG has done. Charity begins at home. Even though we're international, I can't pack my bags today and go to Sudan or Indonesia, and I haven't been to Kenya. So I want to visit as many underserved areas in Kenya before we spread our wings and fly. But let me mention this is not my first mission trip. I have been to other medical mission camps. I've been to one in Kisumu. This was in 2016. That was a different camp. It was surgical. Patients were screened months ahead of time. We did free eye surgeries, cataracts, orthopedic surgeries. We did fistulas, obstetric fistulas. It was mostly a surgical camp. So since this is HAIG's first mission trip, and it's mostly screening and treatment, we want to make the next one, which will be next year, a surgical camp where we're doing all those surgeries I've mentioned. I have to sit down with my board members and decide on the location. And like I said, currently I do have 3 board members. It's 3 of us. It's me, and it's Dr. Kanyaru, and it's also Miss Caroline Obera.